Hi, thanks for joining me today. I'm Dr. Traci Patterson. I'm the founder and president of Holistic Center Treatment based out of Boise, Idaho. And for those of you that aren't familiar with me, allow me just a few minutes to introduce myself, and then I'll talk to you a little bit about more of what we're doing here at Holistic Center Treatment. So first and foremost, I call myself a CRPS survivor. I'm a former patient diagnosed with CRPS over 18 years ago. And I'm now a provider treating CRPS patients, individuals with AMP, fibromyalgia, and even other complex chronic pain diagnosis, I think is a good way of putting it. A little bit more background about myself. I hold a medical degree from University of California, Irvine. I have an additional doctorate in naturopathy. I have a master's in business administration, certified in clinical hypnosis, and I'm also an instructor. In addition to that, I also hold a CEU credentials or have done CEU courses specific to chronic pain, working with cancer patients, palliative care, and even PTSD. So hopefully that gives you a little bit more background on myself, and let's jump in a little bit more. Like so many other individuals that may be watching this or even their family members, I was diagnosed with type 2 CRPS following a foot and ankle surgery. And for me, I'd had so many strains and sprains and orthopedic injuries and even orthopedic surgeries prior to that particular surgery that I knew what it should feel like waking up in post-op. For me, when I woke up that particular day in post-op, I knew that the pain was unlike anything else that I'd ever felt in my life. It felt overwhelming. It was burning, it was stabbing. They weren't able to control it with pain medication. So I knew instantly that something was wrong, but I had absolutely no idea what that was. Now, I was fortunate in that I was diagnosed early, meaning within the first 6 months of the initial incident with that particular surgery. Most patients go years and see dozens, if not hundreds, of doctors prior to their diagnosis. So on one hand, I was told the good news is we caught this early and we're in that first 6-month window. The bad news was I was diagnosed with CRPS, a rare and curable diagnosis, as we're all told. And much like all of you, my doctor really didn't have me any information to provide to me on what was CRPS. Instead, I was told, go look it up on the internet. So when I did, you want to talk about jumping down a really horrible rabbit hole that we all go down. We see the horror stories, we read them, we see the pictures that are just overwhelming and frightening. We read the CRPS is also known as the suicide disease, and that leaves all of us in a state of fear, feeling overwhelmed, and on top of all of that, feeling hopeless. Now, I knew that I had to do something. So I, much like everyone, went to my pain management doc and again evaluated, met the criteria for the Budapest to be diagnosed with CRPS. We started with local blocks, transitioned to regional blocks. Then we transitioned in between all of that with medications. On top of that, years of physical therapy, and then went into lumbar sympathetic blocks in the mix of all of that. Lucky number 13 was not so lucky for me. After the 13th sympathetic block that they used too high of a dose of cortisone or steroid in, unfortunately for me, I ended up in adrenal failure. So that just added a whole nother level of complexity to my diagnosis. Not only did I have to navigate that, add in endocrinologist, more healthcare professionals, more frustrations, more letdowns, I finally was able to bounce back from adrenal fatigue. But that meant the next natural step that my pain management doctors were pushing were spinal cord stimulators. And everything in my being said, don't do it. But I didn't know what else that I could do. We had found a protocol out of the East Coast for hyperbaric. I did 30 plus rounds of hyperbaric, and that did nothing for my CRPS, but yet they were claiming they were getting most of their patients in remission. So I went ahead and did the trial for a spinal cord stimulator. It seemed to help. And then I was referred over to a neurosurgeon who did the real placement of a spinal cord stimulator with paddle. Following that placement in a rechargeable battery, every time I would charge, my foot would swell. 3 to 4 times its normal size. And after having to prove that I wasn't nuts, then they decided to do a battery replacement, put in a non-rechargeable battery. And at that point in time, the whole system went haywire. And I know that doesn't happen with everybody, but that was my experience with the spinal cord stimulator. We ended up removing that spinal cord stimulator. I was talked into putting in another spinal cord stimulator from a different company, different manufacturer. And within months of placing that, there was actually a buildup of scar tissue, not only around the paddle, but on the dura of the spine, between the paddle and the spine. And as that continued to get worse, my neurosurgeon essentially said, hey, Traci, if this continues, then it's going to impinge on your spine. It can cause paralysis, and you're going to have CRPS on top of that. Now, that is one heck of a thing to hear. Needless to say, we did remove that spinal cord stimulator. And when we did, my entire medical team said, hey, there's nothing more we can do for you. From the neurosurgeon to my pain management doctor, his partner, my neurologist, everybody said, we'll do the best we can to keep you comfortable on medications, and that's all we know to do. And that was 4.5 years into my diagnosis of CRPS. At that point in time, I started traveling the world to try and get my life back. Fast forward to that first trip out of country, I did blood stem cells using my own stem cells, and I was confident that that would be the magic bullet. And it wasn't. $25,000 later on that particular treatment alone, my pain levels didn't drop by even 1 point. So I continued to go out of country because I didn't know what else to do while seeing my pain management doctor for medication in Southern California. And through the next 2.5 years, I did silly things, stupid things, but I felt like my back was against a wall. We were turning cancer protocols into pain protocols. They were trying to treat CRPS as if it was 100% autoimmune driven, and I don't believe it is. And long story short, the final pieces that got me into remission were the things that I didn't really have a knowledge base on, the things that I didn't believe in. And that included working with neuroplasticity, working with the brain, getting the body out of fight or flight, and essentially balancing the autonomic system. And then also learning how to manage fight or flight and triggers and stressors. Those were all pieces that helped me get into remission. And the more I dug into them, the more it started to make sense. And that was really the jumping off point to holistic center treatment. So I've been working with CRPS and chronic pain patients for a little over a decade now, and the program has evolved over the last 10 years. We treat the person as a whole. Think of it as a 360-degree program that treats you physically, mentally, and emotionally. Just treating the symptoms isn't working. And I think every single CRPS patient's going to agree with that, is we've got to go beyond just treating the symptoms, and we have to look at the patient as a whole. So being able to take care of any, I'm going to say, emotional charges that are tied in, so PTSD or trauma that may be in the background, helps us on a long-term basis. Balancing the autonomic system and getting our body back into what we call homeostasis will naturally drop your pain levels. And then being able to promote healing so that we're taking those areas that are so painful and decreasing inflammation, promoting healing, calming down nerve pain, and even breaking up scar tissue non-invasively. So when we look at treating you as a whole and yet individualizing a protocol to you, that is what's going to make the biggest difference. So our program is a 2-week outpatient followed by a 90-day home program. A lot of people hear that and they're like, how are you doing this in 2 weeks? Well, people are with us about 5 hours a day, Monday through Friday for 2 weeks, and we're doing 2 to 3 months worth of work in that amount of time. You're given a private room. You're not sitting in a waiting room. It's not hurry up and wait on the next patient. We cap the number of patients that we're seeing, and we really do individualize our program to meet you, your specific needs, and your goals. And then we follow you with a 90-day home program so that you can do the rest of it from the comfort of your home. That includes returning to physical therapy or occupational therapy. My belief is that we need to drop your pain levels so your body is not guarding for you to get more out of physical therapy. And yes, I'm a huge proponent for PT and OT. But when we look at you as a whole and we step away from just treating the symptoms, that is what's going to make the biggest difference in helping you to move forward. So we offer free consultations. So I encourage you to look up our website, give us a call, email us, reach out. So to me, knowledge is power. So you can visit us online at www.holisticcentertreatment.com. You can reach us toll free at 844-994-0999. We never charge for a consult. There's never an obligation to come through our program. But again, knowledge is power. So if you or someone you know is living with CRPS, I encourage you to reach out, grab the information, do your own homework, and decide what is right for you that's going to help you move forward. Thank you so much for watching and listening today. We will have additional videos coming out with additional information on CRPS and other tips and tricks that'll be helpful as you move through your journey. Again, thanks for joining me today with Holistic Center Treatment.